So I'm Suk-tak Chan from the Department of Radiology at the Massachusetts General Hospital. I'm happy to get my teammates to talk about our recent research on the effects of low-level light therapy on resting state connectivity following moderate traumatic brain injury. So will you guys introduce yourself?
Sure. Thank you, Phoebe. My name is Rajiv Gupta. I'm in the Department of Radiology at Mass General Hospital, and I was one of the senior authors on this paper along with Ben.
And I'm Ben Vakoc. I am at the Mass General Hospital also and at the Wellman Center for Photomedicine.
And I'm Nathaniel Mercaldo. I'm a statistician at Mass General and Department of Radiology.
So Ben, can you please describe the light we use in this therapy?
Sure.
In this study?
Yes, thanks, Phoebe. We use near-infrared light, which is a light that penetrates deeply into tissue. So this was light that we could deliver through a helmet, through a transcranial approach, and that allowed the light to reach the brain.
So Raj, why do you think that this light therapy will be effective for TBI therapy?
Yeah, so as Ben said, of all the light that we put into the from the helmet into the skull, a good portion of it actually reaches the surface of the brain, and a good amount of those photons then penetrate deeply into the brain because it's near infrared. And in the spectrum, in the wavelength of the light that we're using, which is about 810 nanometers, light is known to affect the mitochondrial electron transport chain. The effect of this is that there is more energy. There are anti-inflammatory properties associated with these, and there's also vasodilation that has been shown in animal models, but never in humans. And our study was the first one to show what is the effect of this light on traumatic brain injury in humans.
So in our study, we randomized the patients following moderate TBI into two treatment arms, the light treatment and sham treatment. We measure and compare their brain connectivity during 3 recovery phases. The acute phase within the first week of the injury, the subacute phase of 2 to 3 weeks post-injury, and the late subacute phase of 3 months after injury. So Nate, can you tell us the benefit of this study design?
Well, there's two main benefits of the design. The first is the randomization. It helps balance potential covariate distribution differences between the two groups. In addition, the longitudinal nature of the design lets us parse out both short-term and long-term effects. Unfortunately, we didn't have potentially sufficient power to detect long-term effects. So the design of the study allows us to parse those two things apart.
We studied the effect of the light therapy up to 3 months after the injury. What can we do next to clarify the therapeutic role of light therapy?
Yeah, just building on what Nate said, the study showed that light therapy did have an impact on the functional activity, but it wasn't designed to evaluate the clinical outcome measures in patients in the treatment versus control group. So, of course, that's what we're ultimately interested in, is improving the therapeutic or improving the clinical outcomes. And to investigate that, future studies will certainly need to incorporate those clinical outcome measures.
It's great that we have the nice discussion on our study, and thank you for your sharing.